Esteemed participants and distinguished guests, good day and welcome to the Global Prioritization Exercise Outcomes launch for the West Asia and North Africa region. I am Lara Kfouf, Senior Project Manager at Infinite, the Eastern Mediterranean Public Health Network. And we are very excited to have you with us today for this webinar. Before we dive into the discussions, I would like to note a few key details. First, please be aware that this session is being recorded, and this is for us to ensure that the valuable insights shared today can be revisited and shared with a broader audience. Next, I would like to go over today's agenda. We will start with a few welcoming remarks from Dr. Yusuf Al-Khadr of Infinite on behalf of Dr. Muhannad Al-Nsour, Infinite's Executive Director. Then Ms. Jess from IRRA will introduce the GPE, the Global Prioritization Exercise. Dr. Shahram from Deakin University will provide more details on the consortium, methods, and partners. And then Dr. Yusuf will be presenting a summary of results and key findings stemming from the consultations. Following these presentations, we have a dynamic panel discussion lined up, and we encourage your active participation in the subsequent audience Q&A session at the end. To streamline the question and answer process, kindly use the Q&A chat box on Zoom on your screen to submit any questions you may have during the webinar. Thank you again for being with us today. To get us started, I would like to extend a warm welcome to Dr. Yusuf Al-Khadr, Director of the Center of Excellence for Applied Epidemiology at Infinite, to share his welcoming remarks. Dr. Yusuf is also a professor of epidemiology and biostatistics at the Faculty of Medicine in Jordan University of Science and Technology. Dr. Yusuf holds multiple degrees in public health and in epidemiology and in biostatistics, and he is a fellow of the Faculty of Public Health of the Royal Colleges of Physicians of the United Kingdom through distinction, and has received multiple awards for his work. He has published more than 650 scientific papers in reputable journals. Dr. Yusuf, the floor is yours.
Thank you, Lara. Good evening, good afternoon, and good morning. On behalf of Dr. Muhannad Al-Nsour, the Executive Director of Infinite, it's really my great pleasure to welcome you all to this important webinar. Countries in the West Asia and North Africa region face many emergencies and protracted crises that have generated profound humanitarian needs. Within this context, research and innovation proves to be very useful as it can help forecast and characterize humanitarian crises. With effective research, we can effectively identify potential solutions, inform actions, and monitor progress. We at the Eastern Mediterranean Public Health Network, in collaboration with Deakin University and IRRA, are excited to present the contributions of our esteemed panelists to this issue, as the session that follows will unveil the outcomes of the prioritization exercise consultations for the West Asia and North Africa region conducted by these three entities. These consultations focus on humanitarian research and innovation, with a specific emphasis on how the humanitarian research and innovation ecosystem functions, how decisions are made, and who has a seat at the decision-making table. Our esteemed speakers and panelists will tackle many pressing issues, including the role of research and innovation in humanitarian crises, the topics requiring our attention, stakeholder engagement, among its many others. We look forward to hearing the outcomes of the consultation and the discussion on the next steps to be taken. So without further ado, I hand the mic back to our facilitators to lead this informative and enlightening discussion. Thank you.
Thank you, Dr. Youssef, for your words, and I do really echo your appreciations for all our partners involved in this project. Next, I would like to introduce our first presenter, Ms. Jess Kammer. Jess is the Chief Executive of IRRA. She has developed and led the organization from its creation in 2009 to its place today as a leading global actor in humanitarian research and innovation. Jess also serves as a member of the board of Sphere Humanitarian Standards and a member of strategic boards for UK research and innovation, including the UK's Disaster Research Group and previously the Strategic Advisory Group for the Global Challenge Research Fund. Without further ado, I invite Jess to provide us with a comprehensive overview of the Global Prioritization Exercise. Jess, the floor is yours.
Thank you so much, Lara, and thank you, Dr. Youssef, for your opening remarks. It's a great pleasure to be here today for this really important conversation. I want to start with my huge thanks to our colleagues at Infinite for organising this event and for putting together a really distinguished panel, which I can't wait to get into conversation on. I think particularly right now, in the moment the world is in, it can be really hard to think about the role of research and innovation when we're dealing with such terrible humanitarian crises and when humanitarian needs are so huge and so urgent. It can feel that research and innovation are a bit on the sideline and a bit of a luxury. But my organisation feels that now more than ever, research and innovation can help us with these challenging situations. They can provide accurate data, they can help us to tackle misinformation, and they can help us to find new solutions to humanitarian challenges that we so urgently need. My organisation, ILRA, focuses on the role and impact of research and innovation within the global humanitarian system. We fund research and innovation, but we also undertake independent research that we hope adds value to the wider system of actors that make up the international humanitarian research and innovation ecosystem. We believe that research and innovation must be a key part of how the world meets humanitarian needs and how it finds long-term sustainable solutions to the challenges that create and perpetuate humanitarian crises. But for research and innovation to deliver the ambition, it needs to work as a coherent and effective system. And that is why we created and invested in the Global Prioritization Exercise research program. I'm going to try and cover what that is and how it works in the next few minutes. But to start, I'd like to kick off with a video which introduces the GPE program. So Lara, if you could play the video, please. Thank you very much. So the GPE is the biggest program of research that we have ever undertaken in ILRA. As the video explained, it aims to shed light on what the humanitarian research and innovation ecosystem looks like today, how it operates, and who the actors and funders are within it. The overall research programme includes 16 different studies and consultations that investigate different aspects of the HRI system. This includes a desk-based global mapping of the actors and funders that was undertaken by Deakin University, the first ever attempt to track and quantify the financing of research and innovation within the humanitarian system, a series of consultation at global, regional, national and community levels, and research into how the global humanitarian architecture works, the humanitarian research and innovation donors, and the relevant approaches that are being used to measure the value for money and return on investment of R&I, research and innovation funding. Next slide, please. So the GPE programme of work started in 2020 and has involved many contributing partners, including our colleagues at Deakin, who coordinated all of the regional consultations, and of course our colleagues at Infinite, who have led this regional WANA report, West Asia North Africa report. The full GPE programme will come to a close at the end of this year, and we aim to produce our final synthesis from the global series of reports that will bring all the learning together. And we hope to launch this early in 2024, so please do stay up to date and you can receive that global report. Next slide, please. Today is a really critical day for us, however. Today is the launch of the West Asia and North Africa regional report, and you'll be able to access that on our website and through the link that will be posted into the chat. The regional consultations form really the central pillar of the Global Prioritization Exercise programme. They are the central part of how we're going to decide what to do next, helping us to build greater understanding of the context, the needs, and the new capacities and coordination mechanisms that are available in each region. Specifically, if we could go to the next slide, please. Consultations aim to, oh, excuse me, I can't see my screen, 1 minute. There we are. The consultations aim to provide invaluable insights on the experiences and perceptions of the humanitarian research and innovation ecosystem by regional and national humanitarian actors. They aim to highlight the topics and the areas that need humanitarian research and innovation attention. They aim to describe how the humanitarian research and innovation system functions in the region in complex humanitarian environments. And they hope to provide pointers to how we can evolve the ecosystem and improve it at regional and at global levels. Of course, we recognise this region, the West Asia and North African region, is hugely diverse and complex and cannot be easily captured in one relatively short report. We really know that further research and work will be needed, but what we hope is that today the research that's going to be presented will provide us with some fascinating insights into the strengths and the challenges of conducting humanitarian research and innovation in this region. And by doing so, we hope it will kickstart a conversation as to what we should be doing next. By commissioning this research, if you could go to the final slide, please. By commissioning this research, ELRA hoped to facilitate a global conversation on the role of research and innovation within the humanitarian system. But we do not seek to own this agenda. This is not ELRA's agenda, it is all of our agenda. So we very much look forward to listening to the discussion today and continuing to work with actors in this region and others on how we can continue to strengthen the value of this important sector to meeting humanitarian needs. So thank you very much for joining us today, and I really look forward to the ongoing conversation and presentation of the results. Lara, back to you.
Thank you so much, Jess, for that insightful overview of the global prioritization exercise and for sharing your extensive experience in advancing the humanitarian research and innovation. Now, I am very delighted to introduce our next speaker, Professor Shahram Akbarzadeh. Professor Shahram is the Deputy Director of the Alfred Deakin Institute for Citizenship and Globalizations at Deakin University. With a wealth of experience, he actively collaborates with grassroots NGOs, focusing on leadership skills, capacity building, and localization. Unfortunately, Professor Shahram will not be available live for today's session. However, there will be a pre-recorded video presentation featuring him. I will pass it now to Ammar to start the presentation.
Hello, I'm delighted to join you today for the launch of the regional report. As you will hear, we have been involved in a global prioritization exercise for humanitarian research and innovation that is looking at how humanitarian R&I ecosystem functions, how decisions are made, and who has a seat at the priority setting table, and to gauge perceptions of R&I needs. This project has been conducted with a number of partners. It's an international project that is sponsored by ELRA, and our partners include Indica, EMFNet, Passion Africa, World Vision, University of Sao Paulo, and All India Disaster Mitigation Institute, led by Alfred Deakin Institute at Deakin University. The project director is Dr. Marian Abu Zaid, and Shaza Akik has served as our qualitative research lead, and myself as data custodian. This project looked at 6 regions: Latin America and Caribbean, West and Central Africa, South and Eastern Africa, South and Central Asia, West Asia and North Africa, as well as Oceania, East Asia, and Southeast Asia. Consultations were also held in 3 national settings. A series of key informant interviews were conducted in each of the settings. For regional consultations, we had 15 to 25 interviews. We sought to include participants with a range of different functions in the humanitarian research and innovation system. That included researchers, donors, end users of research and innovation findings, and those involved with R&I commissioning and administration. Participants were selected purposefully. A standard interview guide was used across consultations, modified by regional partners as required to ensure cultural sensitivity and local relevance. In some settings, interviews were offered in relevant local languages and then translated into English. All interviews were analyzed thematically, and it's important to note that this project examines the humanitarian research and innovation system. In some cases, participants discussed humanitarian operational system, where those issues were brought up. They had to be excluded from the study because they didn't quite address humanitarian research and innovation. So there are some exclusions to our reports. 7 topics and themes were explored in this study. Consideration of the role of R&I in humanitarian crisis, topics requiring additional research and innovation attention, alignment of investments in R&I with the topics needing attention, regional and national actor engagement with R&I, donor decision-making processes, which is very important, and finally, responsiveness and R&I system to emerging issues and crises. These are some data. 134 interviews were conducted in 50 countries. The key point to take from this slide is that 66% of participants had more than 10 years of experience in R&I. And again, here, 66% of participants had an active role in R&I, with 35% working in international NGOs. There are some strengths and limitations to the study. Overall, the project provides a rich and important insight into how humanitarian research and innovation systems function in a diverse range of settings across the globe, identifying both many challenges and areas for improvement, but also many encouraging examples of approaches and models that really work well. The study captures perspectives of a small number of interviewees who were purposefully sampled, so targeted sampling, While attempts were made to ensure a broad sectoral and disciplinary engagement and representation from a diverse organization types, the number needs to be taken into account as not representing the full gamut of perspectives in humanitarian and research innovation sector. The interviews explored participant perspectives regarding how humanitarian R&I ecosystem functions and humanitarian topics requiring additional R&I attention in each consultation. The reports present summaries of key points raised by participants, and participant responses are summarized in the reports and findings, regardless of whether the report author perceived those responses to be accurate or a true reflection of the situation on the ground. So it's reporting basically on key informants' perspectives. Not all humanitarian issues or research and innovation needs impacting on the region are necessarily covered in the report if they were not mentioned by participants. The study is also subject to some limitations inherent in all qualitative analysis, namely coding is a subjective process. This factor was mitigated through an iterative coding process, including an initial validation exercise between the primary data analyst and the qualitative research lead, and followed by discussion and reanalysis to ensure that coding represented the experience on the ground. Despite the purposefully selected sample size, participants provided diverse views on the topic and rich insights, which provide an important baseline and have generated clear recommendations for action future work should seek to validate the findings of this initial exercise. Thank you.
Thank you so much, Professor Shahram, for sharing your valuable insights. Just to remind you, please feel free to utilize the Q&A chat box on your screen. If you have any questions, insights, comments, we do really encourage your active participation. Now I will pass the floor to Dr. Youssef to highlight the key findings and recommendations of the global prioritization exercise in our region, the West Asia and North Africa. Please, Dr. Youssef, go ahead.
Thank you, Lara. Do you see my slides?
Yes. Yes, Dr. Youssef.
Yeah, it's now moving. It's really a great pleasure to present and highlight the main findings of this exercise that relates to our region, the West Asia and North Africa. You are aware that many countries in this region face some of the largest humanitarian crises in the world that have caused numerous morbidity, mortality, and displacement, and have generated profound humanitarian needs. 70 million people in need of humanitarian assistance in the region, 72 million people in need of health and nutrition, millions of people lack access to safe water, millions of children in need of protection services and educational support. Today, we are really witnessing a humanitarian catastrophe in Gaza, the genocide war in Gaza. Killing civilians, mass destruction of homes, bombing hospitals, schools, church, mosques, people in pain, panic, and fear. No anywhere safe is in Gaza. It is really witnessing a genocide war in this place of the region. I'd like to adjust this to see the titles. I'm sorry for this. So now I'd like to present the findings related to our findings. We ask our respondents, who are key players and actors in the humanitarian sector, about the role of research and innovation in a humanitarian crisis. They all agreed that R&I play an important role for enhancing improved response to crisis, and also they agreed that research play an important role to predict, anticipate, and forecast crises, prevent or mitigate their consequences, and inform needs-driven humanitarian action, and inform learning, recovery, and recovery post-crisis. The majority of respondents stated that the impact of research and innovation in the region is limited. Simply, this is attributable to low production of research and innovation, and also implementation of the findings of this research. They identified several barriers to low or limited production uptake and utilization of R&I, including limited research and innovation capacity. Some countries are not considering research and innovation as a priority, especially the countries witnessing a humanitarian crisis. Limited funding, constraints that are inherited in institutional processes, in addition to challenges of conducting research in a crisis-affected setting. How should research and innovation be done during acute crisis? We asked. The respondent mentioned that research and innovation should be driven by needs and priorities, should be focused on solving problems, and have practical outcomes and actionable recommendations. There was an agreement between respondents that researchers and innovators should be located in the crisis-affected setting so that they can engage with the affected populations. And also, they emphasize upon the importance of participatory research and the processes. How can research and innovation be better used? The majority responded and stated that research and innovation should be done at every stage of the humanitarian cycle to ensure that needs are addressed and also to ensure adequate response. They also mentioned data collected from research in the humanitarian settings should support the development of evidence base. They identified different topics that are requiring attention in the region. The majority stated that health is in need for more research and innovation. And some of them mentioned environmental issues and climate change. Other topics also were mentioned, like economic opportunities, food security, water security, shelter, and cultural and social practices. And they also mentioned some topics that need attention. For example, in health, they mentioned some subtopics such as communicable disease and health security, improving access to and availability of health services. They also mentioned mental health and psychosocial well-being, plus additional subtopics mentioned in health and other areas identified before. So why these issues have not received attention? They mention many reasons. I cite most important reported reasons. They mentioned insufficient funding, inadequate human resources, cultural biases and political sensitivity, limited recognition of research and innovation topics needing attention. Some of them mentioned research and innovation is donor-driven, and others mentioned vested interest. There was an agreement among participants that there is a mismatch between humanitarian topics requiring research and innovation attention and real investment in these areas. We ask about donors and decision-making for the investment. The vast majority of respondents, the 21 respondents, agreed that the investment in research and innovation in humanitarian settings in our countries in the region is limited. And they identified multiple enablers and barriers. They considered the credibility of the recipient institution and the lack of bureaucracy within the institution as enablers. They also mentioned some barriers, like misperceptions of population subgroups and reluctance to fund. Even before Gaza actually war, they mentioned something about Gaza. They said that donors are reluctant to support research in this country or in this region, simply because of the claim that those who are receiving funds are terrorists. They mentioned also political consideration and geopolitical context as a barrier. They also cited poor quality research, limited research and financial resources, and lack of communication between organizations, different sectors in the countries. They all agreed that there is limited engagement and involvement of local and international stakeholders in research and innovation in the region. When we ask about the barriers to the engagement, they again listed lack of funding. They also mentioned that regional and national actors may lack the technical capacity to implement research and innovation. Some of them mentioned a mismatch between donor priorities and national or regional organizational focus. A few of them mentioned the turnover or the high turnover of decision makers in our countries as a barrier. Then we ask about what possible strategies to promote greater engagement and involvement of different stakeholders. They were really informative and mentioned several strategies. I mentioned some of them. Some of them, or the majority actually, said we need to advocate to push research and innovation into the agenda of decision makers, and at the same time convince international donors to fund regional research. Some of them said we need to know our stakeholders, conducting stakeholder analysis. Others said coaching and capacity building, especially in the countries with humanitarian crises that have limited research and innovation capacities. How do organizations identify research and needs? From their responses, we figured out that formal or structured strategies are not always existing in our countries. And when some countries do formal processes, they mention community participatory approach, frequent meetings with a stakeholder, and sometimes there are internal units that determine humanitarian research and innovation priority issues. So how are research and innovation needs prioritized? In fact, they mention several factors that are considered when they are determining these priorities. Some of them include the extent of alignment with national agendas, the extent to which research and innovation topics can bridge a gap or meet population needs, the extent to which research and innovation addresses an emerging threat as identified by surveillance system. They also mention alignment with donor priorities or interests as reflected in the calls for proposals. So what evidence is taken into account in determining priorities? We asked them. They responded. There are multiple evidences taken into account. Most of them mentioned these are determined based on analysis of existing data, regardless its quality, and literature review. Some of them said based on formal structure prioritization exercises such as Delphi method, nominal prioritization exercise, plus others. Few of them mentioned that this is based on evidence that is mostly generated in high-income countries and outside the region. So who is involved in determining these priorities? They mentioned a wide range of stakeholders, officials, researchers, decision makers, United Nations agencies, NGOs, plus others. However, they mentioned that there are some actors who are missing from the priority setting table, mainly the crisis-affected communities and local organizations themselves. They also mentioned that NGOs are not always consulted, despite they are delivering a service and developing innovative solutions. Now, based on these findings, we came with a list of recommendations categorized under 4 levels: national, international, global, and funder level. At the national level, we recommend to develop national humanitarian research and innovation strategies to address priority topics that needs additional research and innovation. Build understanding of the importance of research and innovation among policymakers, funders, and decision makers. We recommend to include or establish a research and innovation units within key government departments and agencies. We also recommend to establish a national central coordinating bodies within countries to regulate, prioritize, manage, and coordinate research and innovation. At the regional level, we recommend to ensure broad dissemination of results and evidence from humanitarian research and innovation activities so that we can support evidence-based decision-making. We recommend to strengthen collaboration and partnership between humanitarian organizations, academic institutions, private sectors, and other collaborators, including donors themselves. Conduct further research is another recommendation that involve a broader range of participants to identify key humanitarian priorities and topics. We recommend to establish a regional humanitarian platform to support collaboration, engagement, and informed dissemination. There is also a need to build a strong, sustainable, and sufficiently skilled and resource humanitarian research and innovation task force or workforce. Also, we recommend to build capacity within national and regional organizations to conduct research and mainly innovation activities during all phases. At the global level, we recommend a transparent global dialogue addressing these challenges and considerations. We strongly recommend also to develop a comprehensive framework for ethical funding and ethical conduct of humanitarian research in a crisis context. At the donor level, we recommend that donors to be more generous and provide more funding, flexible funding mechanism, and transparent reporting processes. We recommend to ensure transparency and inclusiveness in funding allocations and identification of priority topics to be funded through better communication. We recommend increasing fundings towards innovation, especially that relates to the needs of communities affected by crisis. We also recommend to ensure that the funding is based on the needs and long terms of countries in the region. And most important, avoid imposing donor agendas. Thank you so much.
Thank you, Dr. Youssef, for this great insights and for providing us with this comprehensive overview of the key findings, outcomes, and recommendations at the national, regional, global, and funder donor level. Actually, we are very excited to announce that the WANA West Asia and North Africa Regional Report is now live. So please refer to the chat box where you will find the link there. Now let's move to our panel discussions, where we will delve deeper into these insights with our esteemed panelists. And I am very thrilled to introduce our distinguished panelists who will share their expertise in the upcoming discussions. First, we have Professor Abla Mahyousebai, a professor of epidemiology and the Dean of the Faculty of Health Sciences at the American University of Beirut. She's the co-founder of the AUB University for Seniors program and the founding director of the Center for Studies on Aging in Lebanon. She co-led the first global burden of disease study in Lebanon and the first national stepwise non-communicable disease behavioral risk factor survey. Professor Abla has won several awards, including the prestigious L'Oreal UNESCO for Women in Science Award for Africa and Arab States in 2020. Next, Professor Habiba bin Ramadan, a distinguished professor of preventive medicine from the University of Tunis Al-Manar. Dr. Habiba is a former Minister of Health in Tunisia and former CEO of the National Board of Family and Population. She is the founder and the chair of the National Observatory of Social Inequality on Health and the co-founder and chair of the Tunisian Society of Epidemiology and Preventive Medicine. She's also the co-founder and member of the board of the Maghreb Network on Research on Health System and the co-founder and member of the Arab Public Health Association Executive Committee. She was awarded the Maghreb Medical Science Society Award for her work on cardiovascular disease epidemiology and prevention, and was elected through distinction as a fellow in the Faculty of Public Health at the Royal College of Physicians in the UK. Professor Habiba was also elected as a member of the Board of Trustee of the MENA Health Policy Forum and is also a member of the International Academy of Public Health. And last but not least, Ms. Muna Abbas, the Chief Executive Officer of the Asfari Foundation. Prior to joining the Asfari Foundation, Muna was the country director for Plan International in Jordan. She established a wide network of international organizations with strong links to regional and global efforts, playing a strong role in advocating for gender equality, girls' and women's rights, and youth empowerment. Muna also worked with Save the Children and UNRWA to design and lead programs responding to humanitarian needs of refugees and affected crisis population in the Middle East. Together, these esteemed panelists will bring diverse perspectives and insights to our discussions. Please join me in extending a warm welcome to them and to Jess, who will facilitate this session. Please, Jess, the floor is yours.
Thank you so much, Lara. And let me just say what an absolute privilege it is to chair a conversation with such distinguished panelists. So it's an honor to be here and having this conversation. Before I get going, just to say that the Q&A function is getting lively, and that's fantastic. Please do ask your questions. There's some great questions being asked there, and we will be bringing those up in the later half of this discussion. So if there's something in front of your mind that you want to ask, please put it in the Q&A. Okay, so we have just heard a really insightful presentation from Dr. Yusuf, presenting some of the key findings from the regional report and the regional consultation. There's lots in there to be unpacked and discussed, and particularly I think how the current system for humanitarian research innovation is not working as effectively as it could, certainly isn't listening and prioritizing or investing in an equal and equitable way. And I'd love to get the views of the panelists on a particular question to kick us off. So, panelists, given the preliminary results that have been presented and based on your own roles and experiences, what do you think can be done to improve the humanitarian research and innovation system in this region so that it is better able to inform humanitarian action? What do you think we can change and how can we change it? And what do you think we just have to accept and move on from? So I'd like to ask that question of all three panelists, but we'll start with Professor Abler. Professor Abler, over to you.
Thank you. First, thank you so much, Lara, for your kind introduction, and thank you, Jessica. And I'm so grateful for the organizers for this opportunity. Good morning, good evening, everyone. Let me start by saying that I would say that the overall, the landscape of humanitarian research and innovation has been growing in the region. And there are a number of emerging initiatives, organizations, and hubs in the MENA region, mostly concentrated, I would say, in Lebanon and Jordan, only simply because of the proximity of these countries to the main country in countries in crisis, unfortunately. And there are other initiatives in UAE. Yet I would say there are still a number of limitations and challenges, and these have somehow been presented by Dr. Yusuf Khadr and are in the findings of this interesting report. But let me state that these challenges are not necessarily specific to humanitarian research and innovation. These are mainly also can be characteristics of any other mainstream research in what we do. So to start with, research agendas and priorities are often set by the funders, as we know, and are not locally driven, and hence sometimes remain of limited value and of use. For example, let me give you a specific example based on my research interest. We are living in protracted crisis, prolonged for many years. How many of the research, how many of the funding has been directed, for example, to end life care, palliative care, and older adults? It took us ages to convince funding agencies that we need to embrace also non-communicable disease until it became part of the funding strategy or funding topics for funding agencies. Second, there is inequity in resources and funding, as we know, with the majority of funding being concentrated in institutes, agencies, VIs being in the global north, and certain population subgroups and geographical areas receiving disproportionate and less attention than others. Third, as we know, there is weak research capacity among the local agencies, local academic institutions, and among vulnerable populations. And maybe this is one reason why there is inequity in funding between the global north and the global south. So we need to work on this. Work is often done in silos, and there is a lack of collaboration, and not only across disciplines, but also across actors and among actors. And this often sometimes leads to duplication of efforts and hinders knowledge sharing. So a question which is raised, I would like to raise here, how many of the humanitarian agencies know about academic research and vice versa? So with these limitations in mind, let me say a few words about what can we change. All funding opportunities should include components that build research capacity. And when you talk about research capacity, I'm not only here targeting human capital, okay? I'm also and training programs. I'm also talking about infrastructure, not only infrastructure of research institutions and universities, but also infrastructure for local small humanitarian agencies and local partners. Actually, where are the data concentrated? Where are the routine sources of data? They are in these local agencies, local NGOs, small NGOs. And hence we need
there is a necessity and that we need to build capacity for the staff in areas, not only the capacity of the staff and human resources, as I said, but also in infrastructure in areas such as data management and IT support. This ensures their ability to conduct these rapid assessment, basic analysis for continuous evaluation and monitoring, and for evidence-based decision-making even after the end of the project and the funding. Second, funding should encourage national and regional networks, multidisciplinary research consortia, multi-sectoral coordination hubs that facilitate the information sharing, joint research initiatives, collaborative projects, bringing together the key partners and stakeholders from different walks, from different networks like governmental agencies and NGOs. Thirdly, I would say funding also may promote learning centers, not only research centers, but learning centers, knowledge sharing platforms, open data sharing repositories jointly between academia and humanitarian actors. These would serve as knowledge repositories for enhancing and sharing case studies, successful stories, best practices, and evidence-based research findings. With this, I would like to also add two related questions that I still haven't seen them in the literature and would like to see them answered. How much of the humanitarian actors actually are reading humanitarian research literature, which is published by the academia, and used to inform this for their programs? And also, I would like to say how many of the researchers are reading the reports and the gray literature, which is often published by the humanitarian sector, in order to mix and merge between these two sources of information. One would assume that large international NGOs may have the resources, the research centers to have separate research departments, but this may not be the case for smaller scale national NGOs and for smaller academic institutions. And secondly, the research question which I would like to ask, we researchers, it's not a research question as much as a plea that we researchers, involved in humanitarian research, look for grants and proposals that are pegged or tagged to as humanitarian. And sometimes we don't think to apply for mainstream funding, although I would say that mainstream funding in different areas for health, for engineering, for education, for finance, can have application in humanitarian settings if these studies are conducted in scarce resource countries, and vice versa. Many of the humanitarian research can be leveraged and applied to non-humanitarian settings, particularly in resource scarce settings. With this, I will end here, and I look forward to hearing from our esteemed panelists. Thank you.
Thank you so much, Professor Abla. Some really fascinating insights, but also challenging questions for us to dive into when we get into discussion. So a great start for us. I would now like to move on to Professor Habiba with our initial questions. So over to you.
Thank you very much, Jessica. Thank you very much, Lara, for the invitation and for the presentation. Good morning, good evening, everyone. I would like to say that in our country, we don't have a long experience of humanitarian crisis like some countries in the Middle East. We faced the Libyan crisis during the war during the Tunisian revolution, and now we have some issues. We are facing some issues with the migrant from from Africa. I would like to have to give some remark about the document. It's a very rich document. It's an informative document. I have some suggestion about the methodology. Research is, we know what is research, but innovation in the document, it's not clear what do you mean by innovation. Maybe in the methodology of the document, we need some example of innovation in humanitarian work. Second, there is no documentation because in research we usually we have documentation about the publication, about the topic, and maybe also the observation of the field, some example of situation in the field. About the results, you have very good results, and the recommendation are clear, but you mentioned the absence of community. One of the results is that the donors, the policymakers, the stakeholders are present to identify the problem in the humanitarian crisis, but not the community. But there is no recommendation about the community engagement and participation. I think that it is not specific to the humanitarian crisis. Is the problem of the public research when we conduct a priority setting. Usually the community is not present, so we need to strengthen the community, to empower the community to be part of the decision making. And the decision making is not only to participate to research, but to participate to the law development, to the policy elaboration, to the practices. So the community engagement and participation is a pillar of the promotion of humanitarian investment and project. I think that stakeholder also, we mentioned a power imbalance between different actors, between international NGOs and national stakeholders, but there is also a power imbalance between national, local NGOs and community members. So we need to work to reduce the imbalance and to strengthen the national stakeholders. And when we start with the national stakeholders, we will also strengthen the community, and we will empower all the countries to face the crucial humanitarian crisis. I think that also we have to advocate, because I will come back maybe in the second question about the lack of trust between the community and the NGOs, between the national NGOs and the international NGOs, between the national stakeholders and the international agencies. So, and this loss of trust is a problem, and we have to work to reduce this trust, lack of trust between the different actors in the humanitarian crisis. We have also to change maybe the communication, to introduce innovation on the communication, because now the people are not sensitive to the different message. So we have to rethink the advocacy and also the communication about the crisis. Maybe I will come back in the second question to talk about the community engagement. Thank you.
Thank you so much, Professor Habiba. Some really important questions for us and issues to think about. Just to quickly reassure, I think, on behalf of the team of the wider GP exercise, I want to say that there was also intensive work at the community level for the GP exercise to look at community perceptions on the role of research and innovation as part of the global exercise. And also there's a national consultation that was taking part in Lebanon, which focused quite intensely on the role of innovation. So some really exciting real examples of innovation in the Lebanon context as well, which will be published shortly. So perhaps some of the questions you're raising might be answered by those pieces of work, but thanks for raising them. My last panelist is Ms. Muna Abbas, and I'd also like you to start off with our first question on what we can do to improve the work of research and innovation to address humanitarian needs.
Thank you, Jessica, and hi everyone, and yeah, good afternoon, good morning, and good evening. Basically, I mean, depending on where you are on this planet, and I'm really happy to see the number of participants here. Congratulations for you all, and congratulations for this research. Actually, I enjoyed reading the report, and especially with my background, I worked with humanitarian organizations for a long time. And now in my new capacity with the Asfari Foundation, I sit on the donors side of the equation. So it's really like, it's good. It's a good place where you can see both and how it works. And to be honest, and I would like to start with a positive note, that there are a lot of things that are going on well. A lot of efforts are being done, the humanitarian agencies, all this ecosystem is functioning to some extent. And we can see in many crises in the world, in a lot of responses, and recently what we're seeing in Gaza, they are playing a significant role in advocacy, in mobilizing resources, and in putting the light on what's going on in that part of the world, and all the atrocities actually that are being going on in Gaza and in many parts in the world. Of course, things can be done better. There is a huge legacy of in this sector in general that is coming from colonial heritage and post-colonial practices that are hindering us from really listening to the needs and to the voices from the communities that we are working on, giving them the agency in taking the lead and responding to their needs and addressing the challenges that they're facing, and unpacking all these challenges will need a lot of research, a lot of also we need to be open-minded and to be ready to do things differently and to think of things differently, because many times we find ourselves, and I'm talking about everybody here, I'm talking about international NGOs, donors, local actors, and academia as well, that we are comfortable with what we know. And it is really difficult to approach things differently. And we like the status quo. We know the answers. We know how to respond. And that's why we go to communities when we have a humanitarian crisis. And we respond in the same way that we have responded in other contexts and other regions with other people, which usually put us in this situation where we realize after a while that we are not really addressing the right needs. And here comes the research role, where we need always to, when we design our programs, whether in any stage, whether it's preparedness, whether it's the response or in the recovery, this needs research, and innovation needs to go hand in hand while we are implementing and while we are designing. I think that the main problem with research and innovation is that we treat it as a separate component rather than an integrated component in our work. If we just listen to the frontliners, our staff, the teams who are on the ground, when they come back to the management, tell them, well, this program is not working. People are not showing up. People are not happy with what we are providing. just listen to them, because sometimes they bring you the first impression, the first fact. And we need to find ways to integrate the first-hand experiences and the information we receive from our frontline staff and team members, to integrate that into the information system and into our programs, and to be agile and adapt and do quick fixes. And sometimes this cycle takes a lot of time, where we lose the opportunity to respond properly and to respond effectively. And I think that's the gap. I think this is where we have the real gap, is that the detachment between the learning process, whether we call it research and innovation, continuous learning, information management, it has different names. But basically, it's the ongoing learning and adaptation, and listening and harnessing for the real needs on the ground, and to be novel, to be agile. And I think that's if we can address that and find ways where we integrate the learning into our ongoing programs. There are many other challenges, like even the academia, this detachment between research and practice. To what extent the findings of our research is translated into programs? That's a huge gap, and to build these bridges between research and academia and activism and working on the ground and translating these findings into programs and listening to those programs as well, and observing them and taking the learning from our programs implemented on the ground back to academia and say, okay, here's what we have. So that we have this separation and silos, and as the guests here mentioned, that we have that huge separation between what we produce as knowledge in academia and what we are practicing on the ground. And we need to build these bridges as well, and to find the mechanisms where we translate the findings and the recommendations of research into programs, and listen to each other. And that will lead me back to the colonialization influence, and we need to decolonize the research and academia as well, because sometimes we academia and research are sitting in a completely different place, using tools and approaches that are to some extent alienating the local actors and local researchers. And it is really difficult to connect. And we are absorbed a lot by and taken by the academic research and tools, and it becomes a world by itself that is difficult to be understood and seen by local actors and local researchers. Yeah, there are a lot to unpack here, but I will stop. I will stop here. And again, it's a very interesting. I find it a very interesting research, and the recommendations need to be taken further and disseminated further. Thank you.
Thank you so much, Muna. As you say, so much fascinating conversation topics to unpack. I wish we had 2 days for this conversation. We have about 20 minutes left. We have prepared a second question for the panelists, but I know there's lots of really interesting questions also being raised by our audience, and I don't want to squeeze them out. So if the panelists will permit, I will ask our second question, but also add additional one from our audience, and you can choose how best to answer if you're comfortable with that. So Professor Abla, I'm going to come to you first. The question we would like you to answer is, how do you think research can be better conducted and used in times of crisis across the region? Very pertinent at the moment. Are there ways that we can better support academic institutions to better be supported and coordinate with humanitarian actors? So that is an initial question, but I'd also like, if you are able, to consider a question that we have from the audience, which was asking, do you think there are any major global trends or best practices for research and innovation that this region could learn from or adapt? So 2 questions for you, and I'd like to ask you maybe to try and answer both in 3 minutes, if that's okay.
Okay, thank you, Jessica. Okay, so let me start as a researcher. Okay, as a researcher, when we consider the value of research, we talk about several criteria or several characteristics. One of them is how relevant is the research to the community we are trying to address, and what are the questions it seeks to answer, what type of research we are conducted, and will not dwell upon this because Mona has mentioned a lot about research relevance, to be locally context specific, to be locally driven, participatory. And Mona talked about the type of research, implementation research, translational research which can have actionable findings, and particularly in humanitarian settings. But what I would like to add to this discussion is the speed, because we are talking here about humanitarian settings. So it's the speed at which it can provide relevant data in a timely manner. And with time, when we are talking about time, and it's becoming crucial, so we have to think about what are the types of research, the mechanism, the funding flexibility in order to quickly mobilize the researchers, to mobilize the ethical, to quickly expedite ethical review process, data collection, and analysis. And here I would like to put some similarity and to learn from our experiences with the COVID-19 pandemic. Okay, we have seen how the world responded in no time, in exceptional and unique manner to in terms of scale, in terms of scope, in terms of speed, how the pandemic triggered a rapid influx of billions of dollars in terms of funding, researchers sharing data, scientists around the world coming together, collaborating, the publications. You know, we have seen skyrocketing, research has skyrocketed, and you have seen publishing in forums and in media which are not necessarily peer-reviewed like in the research archive or med archives. So the speed by which we need the data is very important in humanitarian setting, and this definitely depends whether we are talking about response or recovery phase, whether we are addressing a man-made disaster or a natural disaster, which unfortunately in the man-made disaster we are seeing increasingly becoming longer period and the like. Now, this in mind, these are the 2 criteria or 3 criteria by which I would like to see the evaluation of research. For the other part of the question, what kind of success stories? I would say that, and success stories and case studies, I would like to say that maybe academic organizations are already working in partnership with the humanitarian agencies on different levels, capacity building and more collaboration. We're seeing more collaboration in co-funding and co-publication. However, what I would like to see also, what I would like to share with you is that there are also funding which are not necessarily research focused. So the entry point to the funding is not necessarily the research. The entry point to the funding, which we are happily seeing more recently, is, for example, establishing chairs for research on forced migration or forced displacement, as we have seen lately at the American University for Beirut. We are seeing joint courses between academia and agencies. For example, at FHS, at the Faculty of Health Sciences, I can share with you the Humanitarian Engineering Initiative, which beyond the initiative, we came up with courses, with a certificate, which bridges between 2 faculty, the Faculty of Health Sciences, the School of Public Health, and the Maroun Semahan Faculty of Engineering and Architecture, where, you know, faculty are collaborating together on providing a certificate, a diploma in humanitarian engineering initiatives. Other initiatives which I would say that are successful are long-term agreements between academia and NGOs, and these provide a kind of I would say these are good steps in the right direction. Such kind of agreements provide not only quick access to resources and collaborative work, but also it provides a site for our students' internship, for our students practica, for capstone projects, for volunteer placement, and service learning experiences and opportunities for our experiences. So within that perspective, I would say that there are some initiatives and successful initiatives for collaboration, for more, I would say, actionable kind of research. And maybe I will end here to say one word, that diversifying the funding approaches from the funding agencies is important. It should not only be research focused or research, the entry point is research. It could be beyond research centric models to allow for more comprehensive, sustainable kind of support system for a number of initiatives and a number of stakeholders. I hope that I managed to finalize what I want to say in less than 4 minutes.
You did wonderfully, thank you. Incredible work, and some really practical examples of the things that we could put into action. So thank you so much for those. I'm now going to move on to Professor Habiba. We have a prepared question, Professor, which is how do we address issues of power imbalance and better operationalize the localization agenda when it comes to humanitarian research and innovation? And I think directly related to that is a question that's been asked by Mohammed Parawana, which he asks, what are the ideal mechanisms to involve communities in humanitarian research? So perhaps you could tackle both of those, if you could, please.
Thank you, Jessica. Addressing the topic of power imbalance is really challenging in our context. First, due to our context, our region is facing crucial political, social, and in some countries, economical problem, and we have the power imbalance addressing is challenging for this reason, and also for the international context. We are going against a rooted mechanism shaped by the international and political questions. So the power imbalance is to address the power imbalance is a shared responsibility at the national level and the regional level and at the international level. At the national level, we have to elaborate a national strategy. In our country, I don't know for the other countries, but in my country, there is no national strategy about the human crisis. Maybe we did not face many crises before, but we need a national strategy. And I think that the other countries need a national strategy. What are the pillars of this national strategy? First, the community empowerment. I think that empowered community is needed to enhance the solving the problem of humanitarian crisis. The community engagement is not easy in our countries because we don't have a culture of community engagement. We have maybe in some countries some examples of community participation in some public health problems, but not engagement in decision making and legislation and policy elaboration. So we need to enhance the community participation, and to enhancing the community participation, I think that we need to work with the national and local stakeholders. Stakeholders are not skilled. In many countries, stakeholders are not skilled to face a human crisis, especially in urgent situation. So we need to scale up the stakeholders with training. And the second issue is the lack of information and lack of data to be used for the decision making. We have to have data about the situation, to have a good analysis of the situation. And as Abla mentioned, the role of the academy is crucial also in our countries. There is a gap between the research in the academy and the use of the results of the research for the decision making. So, we need at the national strategy a strong policy of advocacy about the humanitarian crisis, because we are I would like to say we are acting with our affect, but not with we don't take a decision based on evidence. We are acting with our affect about the Palestinian crisis, about the Libyan crisis. So we need to have data to be informed and to make decision based on relevant data. We have.
Eva, I'm so sorry. We have 10 minutes, and I do want to make sure I give time for Ms. Muna as well.
Okay.
So I'm so sorry.
So I would add, like to add some. We need at the regional level to have network and strong collaboration between the NGOs in the different countries to share experience and to develop policies.
Thank you so much. There's so much, and as I said, we haven't got long enough for this conversation. We could be here for many days discussing many of these issues. But as we have one final set of questions, and I'm going to ask Muna to pick up here. Muna, the question that we prepared was, how can we ensure that donor priorities are better aligned with local, national and regional priority issues? And then related to that, from the floor, Tafazwa asks, the challenges that we face is that research findings, the challenge we are faced with is the use of research findings, which makes donors and other funders see no value in funding more research. There is a need to develop strategy to promote use of research findings to show the value of research and that they can be applied. What strategies can be used to promote the use of research and innovation results and ensure that the investment in research does not go to waste? So I don't know if that's something that you can also pick up in your answer. Within 3 minutes, please, so we have time to wrap up as well. Thank you.
No worries. Very quickly, when we talk about donors, and I saw that in the report as one of the recommendations, and I was interested in that part, and I think you can dive deep into this because it's a big topic. Because when you talk about donors are different. Like we have different types of donors. We have institutional donors and government donors like USAID, EU, like agencies that are related to governments, and those are a very particular these are very particular donors where they are linked to the political agenda of their governments. They report to their governments and they are ruled and they work within the parameters of their foreign policies, where they go, to intervene, what is the agenda, and usually they coordinate with the governments in the countries that there is funding in. The other types of donors are the private donors and philanthropy. And I represent, for example, a philanthropic family foundation. And I think philanthropic donors, they have a kind of a privilege over the institutional donors, which is we're not linked to political agendas and strict political agendas. We can move faster, we can adapt. We don't have that heavy bureaucracy, and they're not usually big machines. for organizations and research organizations or academia needs to understand the different donors and different type of donors they're talking to and they're engaging with. That's very important. And I see that sometimes many donors, and this is responding to the other question, is how to provide evidence for donors that there is a value in research. And to be honest, like in the Asfari Foundation, we have a whole pillar for knowledge production and for research. And this is an area that we historically have been investing in. And because we believe that research is important and research can influence the programs and can bring or put the light on a number of issues that usually the implementing agencies and civil society is not paying attention for it. And we can bring evidence, we can adapt our programs. So the more we prove to donors and funders that research findings can feed into the implementation programs and to improve our response and can be translated into programs, the more we can bring funding for it. The more it is, as I said in my first answer, that the more research is integrated into programs and go hand in hand in one design. It doesn't need to be a product that we need to fundraise for separately. It has to be linked within, because I can, as a donor, I will never, don't give me the opportunity, don't give me the chance to say no for research, go for implementation. Just put them together in a way where they cannot be separated. Thank you. Yeah.
Muna, thank you so much. Really important messages there and also delivered in time. So really, thank you. Professor Abla has asked for 1 minute for an important communication. So I'm going to give the floor for 1 minute to you, Abla, and then we will be wrapping up.
Yes, thank you. Thank you so much. This is maybe off this agenda of this meeting, but as a researcher, I would like to voice out my own frustration and concern regarding the value and impact. You mentioned, Jessica, at one point, whether this is a luxury at this point in time. So what's the value and impact of humanitarian research and innovation in a region where really humanitarian ethics have been totally ignored by the international community? And then we have a funder over here with us at the panel. So I'm asking people in the panel and people who are participants, is it time now maybe to fund not the research, what we need to do, but to expose, because as an epidemiologist, misinformation is part of how I teach my students about, so to expose the injustices in these wars, analyzing the violations and human rights, rights for health, right for safe pregnancy, and exposing the total deprivation of basic human rights. So maybe this is a plea now for the researchers and for the funders that maybe would like now to fund different type of research so that maybe policies in humanitarian policies are better exercised and better driven in a region which is, unfortunately living in protracted and inhumane and unjust world. Thank you. Thank you for this half a minute.
Thank you so much, Professor Abla. A really powerful call to action and a powerful role for research there that I think you're calling for. So I think that's a perfect way to close this panel. There was a really fascinating question asked by Shah, which I'm so sorry we didn't get to, but I would like to try and follow up directly on that because I think it's a really pertinent question as well. Thank you to everybody who's asked questions. I'm sorry that we didn't get to all of them, but really think the panelists have done a superb job in helping us dive into some of these issues. I will pass back to Lara now to close us out.
Thank you so much, Jess, and thank you so much to our esteemed panelists, Professor Abla, Professor Habiba, and Ms. Muna, for your invaluable contributions and enriching our discussions. I would like to draw your attention that we have some useful links in the chat. So please feel free to visit the chat and to have them or to get back to them later on to further enhance your engagement with our topics. So in summary, we have learned about the global prioritization exercise and its context within the West Asia and North Africa region. We have also discussed the key findings, recommendations, at different levels, the national, regional, global, and donor level. And finally, we have explored different perspectives during our panel discussions and gained valuable insights into addressing research and innovation challenges in the region. As we approach the conclusion of our webinar, I would like to invite Jess for her final words. So thank you again for all your active participation. It was really a pleasure being with you today. Over to you, Jess.
Thank you so much, Lara. A few final words just to say that how much I have enjoyed this conversation. For ELRA, this is a really important learning opportunity. We really look forward to carrying on working with all the actors and expertise in this region to think about how we can support a more effective global system for research and innovation that is much more equitable and driven by the priority needs of people affected by crisis. So there's so much that we can take forward and carry on working on these issues that have been discussed today. For ELRA, we will be launching our global report, which brings together all the regional consultations and the other pieces of research that we mentioned. And that will be coming out early in the new year. So please look out for that and sign up to our newsletter if you'd like to attend a launch event that will be happening later on. And I just really want to wish you all the very best for your work, meeting the really priority needs that are ongoing at the moment. To thank you for your time and making the time for this conversation. And particularly huge thanks to all the participants who joined and asked questions and gave up this time. And thank you to all the team at Infinet for the excellent work in organising this brilliant event, and to our panellists for the expertise. I wish you all a wonderful evening and afternoon, and look forward to carrying on the conversation. Thank you.
Thank you. Bye-bye.
Bye-bye.